Every year, thousands of healthcare workers are injured due to manual patient handling. The American Nurses Association and other key healthcare groups have worked together to develop a set of 8 overarching standards that provide the framework to implement a comprehensive safe patient handling and mobility program in any care setting.
The Safe Patient Handling and Mobility Interprofessional National Standards were developed by a group of subject matter experts from across the country. These are 8 overarching standards that provide a solid foundation and consistency for safe patient handling and mobility.
The standards are meant to be interprofessional and to work across the continuum of care.
What's truly exciting about the standards is that they can be applied and modified in as many situations as possible, from pediatrics to hospice care, from acute care institutions to long-term care, all maintaining the goal of keeping people safe.
By implementing the standards, healthcare organizations can create healthy working conditions that can reduce worker injuries.
As part of the assessment process when I'm on a unit, I like to talk to some of the staff that are doing the patient care. And I'll often ask them, do you go home at the end of the day with back pain or shoulder pain? Do you take ibuprofen when you get home? Or do you have trouble lifting up your kids after a long week of work? And they'll frequently say, yes, I do. And I'll ask them, does it seem like that's okay for that to be part of your job? Your job should be taking care of patients in the best way possible and not subjecting yourself to the possibility of injury.
What I think the standard will do is increase the awareness of the jobs that healthcare providers do when they're lifting and moving their patients. Many times administrators or department heads don't understand the physical demand the healthcare provider is going through when they're moving patients. And therefore, when injuries occur, they don't understand where they're coming from.
ANA and the other organizations involved in developing the standards are excited about the possibility of safer work environments and improved patient care.
The great thing about these standards is that they're going to prevent injuries from ever happening in the first place. And for healthcare workers that are injured on the job, this may be a way for them to be able to return to work. When a healthcare worker is injured, they often have a weightlifting restriction, maybe 30, 40, 50 pounds. The typical job description requires them to lift way more than that. These standards will let facilities develop guidelines and policies and purchase the appropriate equipment so that healthcare workers, even those with restrictions, will never have to lift that kind of weight again.